My name's Jerry Maloney. I fortunately brought a friend since I'm not talking very much. My 3-year-old gave me the gift of a viral upper respiratory infection before I left my trip. Not just granny dumping, we're going to talk about assessment of caregiver burden in the emergency department. This is not quite as sexy as Reboa, but it's probably going to be more relevant to you on a daily basis. Disclosures, we have nothing to disclose on this. We work for the VA, so we have to say that the VA did not necessarily endorse this talk. They didn't non-endorse it, they just didn't directly endorse it either. In 4.5 minutes, you'll be able to define what caregiver burden is, be familiar with the existing literature on caregiver burden in the emergency department, describe some screening tools to assess for caregiver burden, and discuss options to assist the caregivers of elderly patients. Here's a case, an 81-year-old with dementia, hypertension, and a couple of other common diseases of the elderly shows up with a 74-year-old wife. He's confused and uncooperative, so he can't really tell you why he's there. And she describes a lot of general issues. He's difficult to manage at home. He's not sleeping. Other similar cases like this. Nursing home sends a resident with a cough to the ER, but when you go to send them back, they say the bed is sold. Or a patient's brought to the ER for weight loss by their family. When you're done with your workup and say they're ready to go home, you can't find the family anywhere. So this should come as no surprise to anybody. We have a boom in our elderly population. The baby boomers are all starting to hit 65 and older. We're anticipating by 2050, which is less far away than I like to think. In terms of elderly living in the community, most of them are living with a spouse or with children. Very few of them are actually living alone, and there's a small sliver living in some type of elderly assisted housing type thing. Interesting thing here, more disabilities are seen in community dwelling elders than in elders living in institutions, at least until you hit that 85 plus part. So especially at the younger ages of elderly, you see a higher level of disability in the community than in nursing homes. Who are the caregivers? Almost 20% of us, about 16% of men and 20% of women. The biggest burden tends to fall on people in my age range, the 45 to 64-year-old. And there's also some income disparity with it. Lower income households worse than higher. This can also be a full-time job, and when you look at by age, the older you are, the more likely you are to spend up to 34, 35 hours a week as a caregiver, and there's a great risk for depression and cardiovascular disease among caregivers. Brief word on elder abuse. Obviously, anything that impairs the health or welfare of an elderly patient, whether it's intentional or not, and that actually includes self-neglect. So it doesn't necessarily have to be somebody else neglecting the patient. Sometimes they're neglecting themselves. We see a fair amount of that. Dr. Huded.
All right, we know much more in the inpatient and the community settings and the ED settings about caregiver burden. Among inpatients, over 50% of caregivers report high caregiver burden, and it's associated with early unplanned rehospitalization. No screening tools for caregiver burden have been validated specifically in the ED setting, but the Modified Caregiver Strain Index and the Zaret Burden Screen are two of the most commonly used, and these are often printed out and given to caregivers to fill out on their own. In the ED setting, our Cleveland VA found over 30% rate of caregiver burden, and an Icelandic study, the only other study we found specifically looking at caregiver burden, found a 28% rate. Interventions that can be initiated from the ED setting include home-based primary care, which is a multidisciplinary team that will go into the patient's home, and cost savings can be achieved through avoiding long-term care or long-term institutionalization. Also, home health aid and adult daycare centers should be considered. There's a price associated with these for most patients, although financial assistance can be achieved through Medicaid and the Veterans Health Administration. Also consider respite care. This usually takes 24 to 48 hours to be arranged and can be started from the ED setting. But the VA will provide 30 days each year for veterans if they need assistance with their ADLs. And then preaching to the choir here, but we know that transitional care nurses will identify and then also address caregiver burden in the ED setting and follow these patients upon discharge from the ED home. You have to remember to search for underlying acute illnesses in patients that have a chief complaint of caregiver burden or failure to thrive, as more than 50% of patients with chief complaints such as these actually have an acute illness. So in summary, caregivers and caregiver burden are prevalent. There's much more work to be done to address this and elicit a caregiver burden in the ED setting, and there's many home-based and community services that can be started from the ED setting. Thank you.
Thank you so much, both of you, for that. Judges, any comments or feedback?
I would just say it's a very nice talk, simple and elegant. I think that a lot of the stuff in the first half, probably most emergency doctors know firsthand, and you might have spent a little more time pummeling us with take-home messages so that we could put your wisdom into action. But I really think it's an innovative topic and a really, really important unmet need for all of us to attend to, and I congratulate you.